Good evening. I'll call the October 23rd Citizens Committee to order. Can I get a motion to approve the agenda? Ms. Curran, seconded by Mr. Curtin. Mr. Perkins, all in favor? Aye. Any opposed? A motion is needed to approve the agenda as amended. Everyone has a copy of the desk. Is there a motion for that? Ms. Curran, seconded by Mr. Jeanette. Any discussion of the modifications? All in favor? Aye. Any opposed? Okay, the agenda is amended. Can I get a motion to approve the minutes of the September 18th meeting? Mr. Jeanette, seconded by Ms. Curran. Any discussion? All in favor? Aye. Any opposed? All right. First, we have an introduction of a special guest that will be brought by Legislator Fay. And so I will turn it over to Legislator Fay to introduce our guests.
And I will turn it over to the author of the book, Keely Harrington, my niece, Harrington Hutton, I should say, her married in Hutton, and a Lemoyne graduate.
Whenever you're ready.
This microphone works?
Yes.
I didn't know if I'd use my teacher voice. Good evening, my name is Keely Hutton. I'm actually a 1990 grad of Canton High School. I graduated in 94 from Lemoyne College. I'm currently a children's book author. And 11 years ago, I had the great privilege of working on Ricky Richard Anuar's story, which came out in 2015 called Soldier Boy. And Ricky is here with us tonight. It is a pleasure to introduce Ricky Richard Anuar to this assembly. At the age of 14, Ricky was captured along with his brother by the Lord's Resistance Army in Uganda, at which time his parents and younger siblings were murdered. He remained with these terrorists for 2.5 years until he was able to escape. Through almost miraculous circumstances, he obtained an education and returned to his very rural district of Pade, where he established Friends of Orphans, a safe place to welcome other escaped child soldiers as well as war-affected youth. Over the years, his organization, Friends of Orphans, has provided mental health programs, food, recreation, education, and occupational training to over 30,000 children. The services provided allows these displaced persons to reintegrate into society. There are currently 600 youth between the ages of 10 and 18 at Friends of Orphans. In 2020, while transporting a woman to the nearest hospital over 3 hours away, she delivered a baby in his car without medical assistance. 2/3 of all women give birth at home or alongside the roads in Uganda. Roads are primitive and cars beyond the reach of most northern Ugandans, so reaching the hospital is very difficult and often ends in death to the mother and child. Public transportation is erratic and only one bus is scheduled, which leaves in the morning hours. After his experience in 2020, Ricky decided a hospital was needed in his area. So in 2021, construction began on the hospital. And this once dream is nearly a reality today. All that is left is tile and drainage systems to be added, and that they will be able to open within the year. Ricky also was recently elected to represent his country in the Ugandan parliament, where he chairs 2 important committees. Mr. Anwar is considered a member of Linda and Dan Fay's family and is friend of their son John Fay, who lives and works in Africa. Ricky is honored to be here tonight to observe how St. Lawrence County Legislative conducts their business.
Good evening, everyone. My name is Ricky Anwar. I come from Africa, from Uganda specifically. Uganda is found in East Africa. I'm privileged to be before you here today. I would like to apologize for my dress code. I know this is a very important assembly. I was supposed to be in a neat suit, but I requested Danny and he said I can come in the way I am. So sorry, forgive me for that. Thank you for the wonderful introduction. As I said, my name is Ricky. I'm here for a visit. I'm visiting the Fay family. I was introduced to the Fay family by John, their son. We met in 2006 in Washington, DC, in Washington University, where I gave a speech. And from there, we connected. This is my 5th time coming to this county. Since 2008, which was my first time. As Katie introduced me, I served in the LRA. We had war in northern Uganda for 2 decades. And this war were used by militia, especially young children. At the age of 14 years, I was abducted with my brother Patrick. Unfortunately, as many children went through, my family were murdered that day, because they do that so that you should not be able to think about escaping. I went through for 2.5 years in their care. I came back later on and went through a process of rehabilitation, though informal. Later on, I founded an organization called Friends of. But before finishing that, when I finished university, I got a job with Ministry of Education in Uganda at the headquarters in Kampala. Friends know it very well because he has been to Kampala, Uganda. But I was not having the satisfaction in the job, so I left the job and took back to northern Uganda, where people were living in IDP camp. IDP camp is internally displaced persons camp. I lived with them in the camp. I created a reception center where the LRA returnees could come back and have food and have shelter. And through the process, I started rehabilitating them through taking them back to education. I was working with them on peace building, human rights, and other services. Till 2021, 30,000 children passed through our organization. In 2020, I visited my home area, and I was the only person with a vehicle. So it happened one day when I sat opposite our health center, where women come and get services. At midday, they told me that there's a young girl who was trying to deliver and she has failed, and I'm to take her to another hospital, which takes about 3 hours. I dropped her safely to the hospital, came back, and I wanted to have a meeting with some people. When I sat for 5 minutes, another emergency came, like, hey, excuse me, there's another woman here who is failing to deliver. Can you take this woman again to the hospital? I dropped her back again 3 hours, came back at around 10 in the night. Still, there was this woman who wanted to deliver. Same day, I took 3 people to the hospital. And the 3rd one at around 3 p.m. in the jungle, the woman started shouting. I was with her and the mother in the vehicle. That put me down, I'm delivering. And it was in the middle of the jungle at around 3 p.m. And there was no help. I'd never helped any woman deliver. And I wanted also to keep privacy as a man. So I stopped, opened the door, and I put her down, plus the mother. Then I was trying to instruct the mother. I had to run on the other side of the vehicle to give privacy to this woman. And this mother was alone trying to help the lady. And I was trying to look around if there's a house I could go to seek help, if I could get a woman maybe who can help a fellow mother. Then I saw a light coming, a motorcycle light. And I flagged them up. There were 2 gentlemen. I told them that I'm taking this mother to a hospital, but she's delivering in the vehicle. And luckily, they had some medical background. So they went there. The woman had a small packet which had everything in it, gloves and cutlass. So they delivered the woman safely. And we continued the 4 of us to a nearby health center, where they proved that the lady, the girl, and the child were okay. That's when I left them. So that touched me, and I promised that I need to build a hospital for this community. And in 2021, through the help of Violet Foundation, we started building the hospital. As he said, we are happy that the hospital is almost complete. We are remaining with tiling and cooking water system. That is what we are doing with the hospital. Through my good work in 2021, I went unopposed in the primary election for the county to become a legislator. And the election came, two people came to try to run with me, but it was just a testimony from the community and the Parliament of Uganda. I'm a national legislator in my country. I'm very happy to be with you today. Thank you so much. As you say, I'm very excited to see how you conduct business. I know I will learn something from you to take it back to my country as well. Thank you.
Thank you, Mr. Anwar. Does anyone have any questions or comments they'd like to share? I just want to reiterate, thank you for coming. Both of you, thank you for being here. It's an honor to have you here. And it is inspiring to see the work you're doing in your own community. We benefit from a reminder of how well we have it here. Even in lowly upstate New York, to have paved roads and functioning healthcare services is something we need to be reminded of the value of this. So thank you, and thank you for investing in your home and representing your people there well. I appreciate it. Thank you. I do want to mention that Legislator Trumanelli, as you see on the monitor, due to accentuating circumstances, is attending remotely at 23 Walnut Street in Brazier Falls. Next, we have resolutions. First, under community services, we have a resolution authorizing the chair to sign a contract with Joseph P. Dwyer Veterans Peer Support Project, Jefferson and Lewis County, to provide the Dwyer Veterans Peer Program and modifying the 2023 budget for community services. Is there a motion? Ms. Curran, seconded by Mr. Denisha and Mr. Janak. Gentlemen, whenever you're ready.
Okay, so the county received $104,000 for the JP Dwyer program. So the JP Dwyer was a veteran history, but okay. But anyway, they made this foundation or this grant funding, they named it after him. So we got $104,000 in September. The CFP met, and there were two proposals. One was Homeward Bound, that was down in Essex County. The other was the JP Dwyer program of Jefferson and Lewis County that originated in Jefferson. So the CSB opted to give the award to the JP Dwyer program of Lewis and Jefferson. And they budgeted about I think it was like 72,000 for an office space and one full-time peer, some office supplies and things like that, leaving around 30,000, 32,000 for what I would call service hours for the veterans. So we're going to be using it for if there's some homeless needs, emergency sheltering, have bedding needs, childcare needs, used for various things. And in addition, we also want to take advantage of the Homeward Bound program because they offer retreats down in the Adirondacks area for veterans. So we'll also be using part of those fundings for the retreats. And we're hoping that we can get enough St. Lawrence County veterans to actually fill up, one retreat.
Yes, as Dave alluded, the Dwyer program was originated around 2012-13. And that was in reaction to Private Joseph Dwyer. He enlisted shortly after 9/11, served in Iraq as combat medic. He had his picture taken actually carrying a wounded Iraqi boy. That picture became iconic. A lot of times if you'll see photos, you would see that photo. I'm sure that you may have it. Of course, the undue fame with him actually came with a lot of PTSD issues. PTSD issues didn't stop when he got home. In 2008, he ultimately had an overdose, which was self-inflicted. A lot of the help that he did receive was through peer-to-peer, through his fellow combat medics. That was one of the factors that did help him per se, although the actual clinical factor of doing it, stigma of going for help through there is what is a big obstacle for many veterans. Therefore, that's why they created the Wire program to make it a non-clinical peer-to-peer assistance to help our veterans. I know that in 2022, they received $7.7 million, which is why we received. I know that the Jefferson County was one of the first of 4 counties that had been doing the Wire peer-to-peer program. So it made a lot of sense to pick Jefferson County. They're established. What that's going to do is put a counselor here in the signature, then off this year's signature.
Any questions or discussion? Mr. Lightfoot.
How are you going to get the word out? I mean, obviously, you're gonna have to go out and find people that are vets that are willing to join into this and avail themselves. Is there a plan to do that?
Absolutely. Well, I need to speak with the manager. I've been in contact with him as far as establishing where they're going to put space. But once that does establish, they're going to have media coverage to get that word out. It'll be CNBA clinic, the state reps, Watertown Vet Center. So that again, that's a EA.
Any other questions or comments? Thank you for bringing this forward, Mike. I know how much you and your small team does for our veterans already with so little. And so it's exciting to see this resource being allocated. This is significant, and we're looking forward to seeing the impact it's going to have on our veteran community.
I do too. You know, personally, it's been 17 years since I've been in Iraq. Time has a habit of healing things, but some things just don't go away. Mental, physical things, just you'll never escape it. I'm sure you can attest to that. So it is nice to be able to have that. Not everyone can recover from certain things, and we need a little extra help. So I think this is going to be the help that is. I appreciate the support. Thank you.
All in favor?
Aye.
Any opposed? Resolution passed. Thank you. Appreciate you being here. Next is continuing community services, a resolution authorizing the chair to sign contract with the New York State Governor's Traffic Safety Committee to accept the 2023-2024 traffic safety program and child passenger safety grants for community services. Ms. Curran, seconded by Mr. Jeanette.
Okay, so this is a resolution that we pass through every year. We get this funding from the Governor's Traffic Safety Committee. This year it's totaling $101,176. It's up a little bit from last year. So we're just asking for the chair to sign contracts for both of these contracts with the child passenger safety grant as well as the traffic safety grant.
Any discussion? All in favor?
Aye.
Any opposed? Resolution passed. Next, we have a resolution modifying the 2023 budget for community services for comprehensive opioid stimulant and substance abuse program, cost of one, funding from the Office of Justice Programs. Got a motion, Mr. Jeanette, seconded by Ms. Curran and Mr. Brown.
So this was the first CASA grant that we had starting in 2020. We did get an extension because we had some unallocated funding remaining in the budget. So what we did was we had some admin and fringe, salary and fringe that was not spent down because the person who was reporting out to the grants and doing the vouchers didn't spend the entirety of her time doing, that duty. That person also gets some financial responsibility. So we had this extra funding. So we're moving it out of the direct services, the 1,200 line. We want to move it back into the A15, which is the grant itself, so that we can roll that over and then use this money next year primarily to offset.
Is there any discussion or questions? All in favor?
Aye.
Any opposed? Resolution carried. Next we have program service statistics updates. Okay. So this is for the month of September. For the most part, the numbers here are fairly flat. We've kind of reached a plateau in terms of a lot of these report outs. In terms of the wait list, it says here there's 28. That is now down to 13. Again, that is for addiction services folks who do have a counselor, but are awaiting to be assessed for medication assisted treatment. We did add some new charts for the opioid dollars paid, dollars billed, same with mental health, same with substance abuse clinics. So there is still in the denominator, still includes some of the rebills of denials, but I mean, are able to see a little bit of trending. And lastly, we did take out the addiction services counselor hourly splits between the clinics. The counselors, sit in the seat and they could see someone from a T in a different town. They could see someone for substance abuse services in a kind of first available. So our clinicians really do kind of work between all three clinics at this point. Any discussion or questions? Okay. All right. We have Commissioner Seaver, social services. Yes, this is a resolution modifying the. One moment. This is this. So our next resolution is modifying the 2023 budget for social services for office renovations in the Harold B. Smith building. I get a motion. Do that, seconded by Mr. Perkins and Mr. Curran. Mr. Lightfoot.
Before we get too deep into this, I'd like to offer an amendment to this resolution needed because a budget mod is needed. So when looking at the original resolution, in decrease appropriations, you will see an amount 293,000, excuse me, 524,051, the same as the increase in appropriations number. That is needed to be deleted and replaced with the following: an increase in revenue heading, and the first of four of these additions. First one, the numbers associated with it in the budget are DA David Adam 03610556000, And that is identified as DSA General Administration, and the amount is $45,518. The second addition is number DA 046105 57000, and it's identified as DFA General Administration, and the amount is $98,803. The third addition is identified as DAS 36105 560 CW, Charles William. That's identified as DSA Child Welfare in the amount of $59,315. The last is identified as DAF 46115 57000, and identified as Food Stamp Administration, $26,769. The total amount of the increases in revenue is $230,405. From the contingency account, in order to make up for the increase in appropriations, the difference between the increase in revenue, out of contingency, the amount of that would be forwarded to this resolution would amount to $293,646. Adding that figure to the increase in revenue equals the $524,051. And I would move for that's adoption.
Is there a second, Mr. Reagan? All in favor of adopting the amended version of the resolution? Any opposed? Okay, any discussion on the resolution as amended? Oh, the Commissioner Seaver can speak to the resolution. Thanks, sir.
Good evening, everybody, and thank you, Mr. Lightfoot, for relieving me of the responsibility of all these numbers. I appreciate that. So this is a resolution, basically for continuing with our improvements to the Harold B. Smith building. That building has been around for 50 years plus, definitely in need of some updating. We started that project in the Medicaid area, and we're moving on, and that's all been taken care of. This is for the remainder of the building for cubicles and carpeting, which is desperately needed throughout the building. So we were able to take a look at it. My wonderful new director of finance was able to find some reimbursements for us in some areas, so we were able to reduce the impact to the contingency fund on this. So I really think this would be a wonderful help, not only for the efficiency of the building, for the appearance of the building, but for staff morale and my efforts to try and maintain staff, to give them a work environment that is more modern than some of the furniture that is in there. I believe some of those chairs may have even been before we replaced them, original to the building. So I would ask your indulgence on this resolution.
Is there any discussion? All in favor?
Aye.
Any opposed? Carried. Next, we have a resolution modifying the 2023 budget for social services for the relocation of the legal staff to the county attorney's office. Can I get a motion? Ms. Burns, seconded by Mr. Jeanette. Mr. Parkins.
This is also a resolution speaking to the fact that we are making some changes in the building. This will allow illustrious county attorney to have this moved over to his area, and also free up space in my building, which any of you who have been on the walk understand that the areas, some of them are very congested with staff. So this resolution is for the furniture, furnishings, carpeting for that area, so that Mr. Button can have his staff where they need to be. So I've asked you to consider this resolution.
Any discussion? All in favor? Aye. Any opposed? Carried. Next, we have a resolution modifying the 2023 budget for social services for child care. And motion. Current, seconded by Mr. Jeanette, and Mr. Perkins. We're on a roll with the motions. Commissioners?
So this resolution is for additional funding that we received for childcare. Over the years, the need for childcare has increased dramatically. Calendar year ending July 31st, 2023. We had 208 families and 435 children receiving benefits from our program. The previous year's span was only 101 families and 187 children, so it's more than double. Based on that, and the fact that the state of New York has increased its eligibility or has loosened its eligibility requirements to allow more people to be eligible, we are seeing a massive increase in people requesting assistance for this. I think this is a great opportunity to get some people some relief so that they can go to work and not have to worry about the children. So we received an additional $600,000 for this out of the New York Child Care Block Grant to help get us through. Without this funding, we would, over the course of the fiscal year, we'd be very soon running out of funding and having to put people on waiting lists, which could have some ripple effects throughout the county. So I'm very pleased that we received and were approved for this additional funding that we requested. And I would ask your approval on this resolution for this this increase.
Mr. Forsyth.
Thank you, Mr. Chair. Mr. Subers, is there enough childcare available? Are there enough providers?
I don't know that there's ever going to be enough. Right now, we have 71 providers, I think was the statistics, and Mr. My deputy Hamilton will be speaking to that here in a little bit about the numbers. We are always advertising, looking for more childcare. There is a need throughout the county. Unfortunately, a lot of our childcare providers are concentrated in the more metropolitan areas. We have metropolitan areas in this county. Augsburg, Messina, Governor Potsdam, Canton. A lot of our residents don't live in those areas. So I think the opportunity to have more funding and loosen up the requirements. Additionally, they've loosened up the requirements for people to get certified to house, to have childcare, to run childcare facilities. Also loosened up the requirements to allow people to have non-traditional individuals receive funding. In the past, they couldn't, for example, family members or friends. So this will really allow us, with the new changes coming through from Albany, to hopefully increase our. That's the long version for no, but hopefully, sir.
Okay, thank you.
Karen.
I'm just kind of checking back. When you say that you don't have enough rural people, brings me to that other situation. The daycare provider for ages. Have you ever?
I cannot speak to that case, ma'am, Mrs. Clinton, so. This is it's underway.
Any other questions, Mr. Lightfoot?
Mr. Seaver, this is quite a hefty grant that we're getting. But up in the whereas, it says in the calendar year ending July 31st, 2023, blah, 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 blah. Where is this money going forward, or is it used to reimburse the county for prior expenses?
This is for money going forward so that we don't have to get into that situation.
Okay, so it says that we're modifying the 2023 budget. Is this something that would carry over into 24? Or
Yes,
we're going to
this
spend
money-
it all by the end of the year?
This money can roll over. So when they rolled out these requirements, they started sending people from Albany around to all the districts to try and talk to them, find out what our needs are, what the impacts are. So we're all kind of, this is a new situation for all the districts. But the plan is that this will get us through the remainder of the state's fiscal year, and then it will be included in our allocation moving forward, plus whatever we roll. So this is kind of an ongoing thing, anticipating the fact that these numbers are going to continue.
Do you, if I may, do you anticipate that we will receive a like amount at the end of the state's fiscal year in 2024?
I do, sir, if not more.
All right, good. Thank you very much.
Yes, sir.
Any other discussion, Mr. Burke?
So increasing by 600,000, what is that from?
I don't have that budget figure in front of me, sir. I can get that for you.
Well, I was just curious because like you said, not
Well, it was what started us? We were about 1.9 million this year. This will bring us up. Get us through it.
that's enough to cover even.
That projected, yes, sir. That's our projections were. Yes, sir.
Any other discussion, questions? All in favor?
Aye.
Any opposed? Pass. Next, we have statistics update.
I'm going to ask Mr. Hamilton to come to the statistics, because if you have questions, he can give you more in-depth answers for some of this data.
Thank you, Commissioner. Good to see you.
How are you? Good evening. So we're gonna be starting on page 7 with eligibility programs. And looking at specifically what I wanted to highlight here was more the TANF, safety net SNAP. We've seen a slight increase in those cases for September. That's most likely due to kind of seasonal job changes, as well as there's a kind of slight uptick in unemployment in St. Lawrence County as well. So there's some connection, but it remains relatively stable. Mr. Seaver took my thunder on page 9 this evening with the child care assistance. To be a little more specific with regard to kind of the funding piece, we saw on October 1st, there was another increase in the eligibility requirements, making more individuals in the county eligible to receive services. So going forward, we are really going to have to be evaluating how many applicants we're getting and the funding that we have. Because when we approve someone for funding, we have to approve them for the full 12 months. So we have to make sure that funding is available for the full 12 months for that family. So we're in talks now, working on coming up with a system to really keep better track of that. We are seeing a significant increase in applications. We have over 30 pending right now, considering that prior to these changes, we had maybe 60 families receiving these services, and we already have 30 applications. We're up to, as Mr. Seaver said, over 200 approved families. So there is the potential, based on the figures, that we could see, depending on how this program is received by the community, we could see the implementation of a wait list at some point. That's not the situation we're in now. But again, depending on how many individuals take advantage, that could be a situation we find ourselves in at some point.
Mr. Burke and then Ms. Curran.
Page 8.
Eight.
Mr. Curran.
My question, the farm bill didn't pass. Temporary assistance to family comes out of the farm bill. They were supposed to put out someplace what the interim payment would be if the farm bill didn't pass. Do we know that? Because sometimes they could affect like the 1950s rate, and this is the first time that the temporary assistance families cracked at $1 billion.
I'm not sure that the child care block grant would fall under that as far as impacting the reimbursements. We're not aware of any issues coming with that.
But you were talking about the temporary assistance to
Oh, and the first
families
aid.
part of it, and that comes out of the farm bill. Ruth, can we know at some point, like,
We can look into that.
what they gave us for funding? Because I know it's not the same if they don't have that. Thank you.
Mr. Jeanette, did you have?
Did. Sorry, am I good in my own?
Just push the red button.
Thanks. My other question was, so with this and the added up families for extra applications and everything, going forward with this, how is are we gonna be able to answer these questions that some of these families stuff? Is there gonna be some good actual, like, people can ask questions, good places where they can go to get good answers for this and then go waiting for answers that could potentially either push them out in some kind of, putting out that family that maybe they missed a deadline on that because they missed something before, or I think you kind of know where I'm going. I'm just making sure that the resources are there. That's great. We're helping these families, but the biggest thing I always hear when certain families have questions for programs, they have nowhere to go and get answers. So that's I think if you're gonna support that, you really need to support those families too, not just put it on to those people that are trying to have.
So the Child Care Council actually administers, as well as OCFS and OTDA, they administer the actual operation of childcare centers. We don't, the only role the county plays in all of this is a reimbursement mechanism. We only handle the financial components of that. We don't do anything with the applications as far as, we just do the funding piece. So families, they have access to the website through the Child Care Council, through New York State, for all the frequently asked questions, the deadlines, the information, the forms, as well as our staff are available to assist as much as they can and direct them to the appropriate source.
Thank you. So Legislator Jeanette's question, he's hoping that on the funding side, if they have questions, they'll have someone go for the clarification on the ground rather than through the system.
Absolutely, we're always fielding calls from families that are applying for services. We do assist them as much as possible with the application process, getting the funding. And we do notify the families within 30 days whether they're approved or not. And we're actually doing that at this point a little bit sooner than that. So we try to communicate as much as possible with the families as quickly as possible.
Your point's number.
First, we have Mrs. Haggard and then.
I'm gonna be sure I understood. You said that the criteria changed again. Is it
October 1st.
October 1st? Does that mean the families can make more money and still apply? Okay, so when they go to apply and you guys consider who's eligible, is that taken into account or is it a broader set of criteria other than income?
It's pretty much just strictly income based. It's an eligibility based program.
So when the funding is not there, those will be the people that probably won't be. You see what I'm saying?
So there are specific guidelines. If there is ever a wait list, if you were to experience that in the county, the state does have specific priority boxes of individuals that would be priority over another. It's pretty complicated, but
That answers my question.
Yeah.
Thank you very much.
well,
If I heard you correct, I heard that another agency reviews the application and makes the determination on whether or not the family or the applicants are eligible. That it is not a DSS function. DSS's function is to essentially write the check. Is that correct?
so we make the decision on eligibility for the families, whether they're eligible for services. I was speaking about the child care centers or the child care providers. They're overseen by the state. We just handle the financial piece and the eligibility.
All right, but with respect to the it is a county decision as to whether or not they meet the eligibility standards.
We're making that decision locally.
All right, thank you.
Mr. Ray.
Can we cover any category? I wanted to go to page 6.
Knock yourself out.
Thank you. On page 6. On page 6, in the new homeless placements, I just wanted to clarify, we've got 36 in April, 44 in May, 22 in June, etc. Is each one of those numbers new individuals who have been assisted by the department, or are they included in the following month?
So those are the number of individuals that we have for that month. So that's the total number of people that we have that are homeless, or people like, it could be families as well. So the total number of households receiving service.
Cumulative, correct? That's what your clarification is. It's not
It's keep,
22 plus 35 plus,
Right.
it's-
that's
the total is 35.
correct.
That's your question.
So the August versus September of 2023. In August, there were 27. Whether they were individuals or families isn't clear. And then in September, there were 35. Were the 35 is the 27 included in the 35?
Yes.
Okay, so I'm not quite sure what this means when we say new homeless placements. What does that
So that's just
exactly mean?
I would have to dig a little bit more on the data, but that's just essentially the number of homeless placements we had for the month.
What do we mean by a placement?
Placing a family or individual into a hotel or services.
Okay, so when we say 35 in September, it means there are 35 either individuals or families living at hotels or someplace that the department has designated for them. Right. Okay. Thank you.
More on that, maybe to clarify, because I'm still a little foggy on this, and maybe we could review this offline, just to clarify this, the stat. But is there, when I see placements, I think sort of additions to that service, people who are newly served by that service. Would it be helpful to break it into placements versus people who are continuing to receive a worker who are persisting in a placement that the county was part of? You know what I mean? But am I being clear about that?
It sounds like maybe you're looking at maybe another data point.
Potentially. Okay.
I think I get what you're saying. I think you're looking at how many people are remaining, what's the length of time kind of that they're receiving that.
I guess really backing up to the sort of 20,000 foot view, what I'm looking for here and don't see is in the last 6 months, how many individuals or families have been part of this program, have been placed. And if we knew that aggregate, because it's not clear between August and September, we add together the 35 and 60 centers, or of those. So if you could provide some clarity, or Commissioner Seaver maybe has clarity.
Each month, it's how many individuals received service that month. Some of those people may have received it the previous month, they may not have. Some of those individuals, for example, may have been placed for one night, but that counts as a placement for the month. It's not saying that we have 35 people placed for the entire month, or at any given time, we could have had, 7 people the first week, 4 people the second week, and added up that way. Over the course of the month, there were 35 units, whether it was individuals or families.
That helps. Ms. Reagan, and then Roger.
So do we have any idea what happened to any of these people?
Some were living with friends or family and were kicked out. Some were evicted. Some.
No, I understand that. I'm wondering what happened after we interacted with them.
We can see what.
I mean, because, I think that what I'm looking for is, my constituents are asking, what is it that the county is doing about this homeless problem? And, what they're looking for is, not that we put them up for one night and then they went away and we have no idea what happened to them. We don't care. What they want to know is, did we get them into treatment? Have we found some sort of, did we get them into some sort of supportive housing, some sort of temporary housing, some sort of, what is going on? And, when the commissioner told us he was setting up this task force to address the problem. I was very pleased and I'm very grateful, and I know the department's working on it, but I don't think that these numbers tell me what I need to know in order to determine what's happening on the ground, much less to, answer the questions from my constituents. And as we are now in the cold weather and it's gonna get colder, people are wondering what is happening. And I think, there, as the weather gets colder, a lot of individuals are willing to change their behaviors in order to come in out of the cold. Where during the summer months, it was much easier to not. So, I'm not sure how the numbers can be reflective of that, but what you could do to help me and others understand what is happening out on the ground would be helpful.
Absolutely, and we have, in the past, when we presented services statistics, we share the number of permanency that the homeless unit has experienced in that particular month. And we certainly can add that to the statistics going forward if that would be more helpful for you.
I think that's what we were looking for when I asked that this be developed is, there are various programs that, whether it's over at Lincoln School, there's a host of programs out there that I'm sure your people are trying to transition people into. And I think that's what we need to know about.
Absolutely.
So the homeless unit, and I can get those numbers for you. We actually have those. The homeless unit has placed a really significant number of people into permanent housing. There's SRO. They've actually been fairly successful in doing that.
That's the number I'm looking for.
I will get that for you.
Mr. Webster.
My question is more of the income guidelines. We've got food stamps or some services. No, it's not to the dollar, but like, see, a family of 4 might be $60,000. Family of 3 might be 50, like $10,000 increments. Do we know percentage wise in the county, how many people fall on those guidelines? I mean, I know a lot of older people who are living on retirements that are far lower than these income guidelines and are going for help. Do we have, just so we can have an idea for the future, what could be prepared for what could happen? Like, do we have any idea percentage wise how many people in San Luis County are falling under these guidelines?
I think that would be something that would be in the census data. I don't know that, I think that would be the best place to obtain that information regarding income. That's typically what we use when we're looking at those, so the census data. I want to say in the food stamps, that's something that we can look at modifying as well when we look at the population of the ones that are the most zip codes that are receiving services. We could look at, can we incorporate the percentage of population that kind of falls within? We can look and see what we could do with that.
We really don't even know what some of the population is under those incomes and just not. Maybe some insight for the future to have an idea where this is going to go.
We can certainly take a look at that.
Thank you.
We have a few legislators in line. We'll start with Ms. Curry.
So bear with me on this. I'm kind of wondering, when I look at April through September, there's about 200 people served. I'm sort of looking to see how many unique individuals are we serving per year? Like, is it one person on each, like, where are we? And then how many people are we serving? we've got 35 situations that we dealt with. Does that represent 35 people? Does it represent 135 people? Like, what kind of preparation do we need to make sure we don't have this problem forever? Just not knowing where your housing situation is extremely stressful to people. And then how many days, like, those 35 unique situations in September, how many days are we housing people for? I know sometimes people get dropped off my place of employment from other places, but people don't want them. And we don't have a great way to plan for that, because we don't know how many different places there are. We can see people, how many people it can hold, but we don't have, you probably do, but I don't really feel like we have a sense of what we're really serving, people-wise, numbers-wise.
That's an area that you're gonna see some significant improvement in, over the course of, especially this winter. Since last year, we've been working on beefing up our demographic data and databases. So we should have a much clearer picture for you as we go through the season of what that would look like. And I think that would, kind of what we got in the works will really kind of hit what you're looking for.
Okay, but we could have these numbers, like how many people are we serving, how many days are they in care almost, and then how many unique things per year. I'll have people who do food pantry say, what do you see as a trend? Do you see this going up? Do you see this going down? Should we be writing more grants? There was a point last year where I said, there was a gentleman that wanted to give us a building to make a countywide food pantry. They said, oh no, there's not the need. We have food everywhere. We can't keep track of it all. This year they're saying, okay, is there any? And I guess I'm kind of trying to figure out, like, is this need that we have affecting that need that we have? And if we could pull some numbers together, you could probably get some better data for the people who write the USDA food grants, that think about how are we going to deliver this. Does that make sense? Just for projected need. I mean, I never would encourage anybody help, but if we know we're going to need to help 200 people, or kind of think we might need to, maybe some of these local food pantries prepare better than if they think, oh, actually, these numbers are going down. We've got 36 situations. That's not bad. We can pull that together out of our communities. Thank you, gentlemen.
Next, Mr. Burke.
I have two questions. The first has to do with the average days children that are here. The number is rising. And I guess on the bars right next to that, the number of children in care is the length of stay.
If I can answer that question. So part of what we're seeing now is we've been doing a lot of work to get children out. And the children that we're getting out of care are the ones that are the easier cases. So you take those out and the average length actually goes up, because the kids that we have left are some of the difficult cases. I've been working with the adoption unit quite a bit lately. We actually have, and indeed, Mr. So hopefully, there will be. So that average days in care, what we're seeing represents a skew in the numbers, because the kids that we have left are more problematic situations for having trouble.
The other part of that is the number of children in residential treatment facilities. And ballpark costs for that.
That's a tough one. We never know what's going to happen. It depends on the day. There are certain situations where they just want to send kids off to juvenile detention, trying to get some of those kids taken care of, but they represent our more problematic cases in terms of very wildly. One kid, based on their needs and the type of placement they might get, really skew numbers. So if you know exactly what you're looking for, I can get this
Well, just in general. I know residential costs a lot more than child and foster care. So I guess I'm just wondering, as it relates to county costs, are our costs going up? Are there more children in residential treatment? And if so, do you have some sense to what the cause is?
The cause is something that's hard. You know, it could be, you know, family breakdowns happen for any number of reasons. It could be drugs, it could be a number of things. Right now, we have, yeah, we've got about 23 kids in institutions right now, and that's a various variety of different. So it's gone up a little bit. A couple months ago, we were 18. It just depends on what we have coming through the door. We might have to get a kid in this institution for 6 months.
That changed over.
It's gone up slowly. It has gone up slowly, and it is expensive, and it does increase the county cost. I can get that number.
Well, just a sense of where we are. I know it's hard to get much positive. It would be nice to have some sense of what's going on with the daily.
I would give my supposition that the increase of substance abuse issues in the county and elsewhere contributes. Can't see how it would, but you know, the exact data.
How fast? Most of them-
Track of by diagnosis. Like, are they all opposition or defiance? Kids that end up in,
I couldn't give you a breakdown by diagnosis. And you may have a kid who is, for example, intermittent explosive disorder, oppositional defiant, that can be in maybe a therapeutic foster home. You might get a kid with the same diagnosis, whose behaviors are just a little bit different, and the judge says, this kid goes to detention. We don't really have a breakdown by diagnosis. So it's not something to be really.
that's when, I mean, I see some kids that go that route. And I wonder if we have, at the county level, is there a specified operating procedure about what makes them decide this kid's gonna go, that kid's not gonna go? You get so many, like, you need this kind of treatment, you need this kind of treatment, you get this kind of treatment, and then if you don't,
Yeah, a lot of that's decided by the courts, not by us.
not by us, we don't have a, you know what I'm saying, Mr. Hamilton, we kind of know where I'm coming from. I find that some kids end up there about stuff that I would be like, really? Like, what are we doing? So I wondered, do we have some sort of a specific process that we go?
We'll extend the table here and recognize Mr. Button, our illustrious.
Because I know you could
county
do this.
attorney.
I have a little more information. I'm sure everybody is. An increase in the number of people. That increase has prompted a significant amount of adjudications from my office, because my office actually had within the county. We try to achieve an objective. There's a child under the system, there's the family, there's the community, but we are seeing an increase in the number of those cases that are coming through, and we are seeing an increase in the number of those cases that are ultimately in placement. In those situations, the diagnosis files into consideration. The least restrictive means to achieve the ultimate objective is the legal standard that we have to utilize in order to determine whether or not a placement should occur. We really do try to watch with respect to our 10 placements. We do track along with that, but I don't want to say that just because an individual has a diagnosis, they're going to wind up in a specific location. Our primary objective these days, I think, Commissioners. And at least since 2021, our objective has been try to find placement modalities that are familiar. We are looking for grandparents. Trying to keep these kids in household environments so that they can be as least disrupted as possible. And I think the numbers speak to that. Of the 211 kids in care at the end of September, you had 117 that were in fit family relative placements. With the 23 that are in institutional care, of the 211 that are in there, that's a relatively small number. You're talking about roughly 10% of the number of kids that are actually overall in care. And even then, that may not have been driven by a diagnosis. It may have been driven by pure practicality. There was no other option. We would prefer to have a familial option.
So, thank you. So I guess I was just trying to figure this out. That is kind of, I didn't realize that we go RTX with someone it's legal.
Yes, yes, we do.
That explains the number better.
And in fact, this past year, there was a change in the law, and the change in the law now requires us to notify the court immediately if we are seeking a place. We have to have an evaluation that is performed by a certified QRTI or qualified residential treatment evaluator. These individuals come in, they take a look at the child, they will evaluate their needs, they will evaluate for any diagnoses, and they will make a written recommendation to the court as to whether or not one be placed and the duration of that placement. So this is a heavily regulated area now of the foster care placement process.
Is there any other discussion or questions to our expanding panel? Okay, thank you, sir. Appreciate the report. Next, I'll invite up our interim director of public health, Ms. Zimmerman. Our first public health resolution is authorizing the chair to sign an amendment contract with the Health Research Team, New York State Department of Health for epidemiology and laboratory capacity, COVID-19 enhanced. Mr. Jeanette satisfied.
As was mentioned, this is a resolution looking to extend our contract for the grant. You might remember this grant was initially extended to December 31st, at the end of this year. And now we're able to extend it all the way through till July 31st, 2021. Right now, we have a little over $185,000 left in the grant. It is primarily earmarked for staff salary and fringe. But we're also looking at clinical accessibility items such as like ramps for individuals who might be in wheelchairs, just to access any clinics that we might be having or pop-up immunization events. And they actually expanded the grant itself too to also include other infectious diseases. So we're looking to see if we can also get some tickets. Those are one of the first items that go at community events. Everyone wants to get.
Any questions or discussion on this? Probably we're not limited to COVID-19 related activities on this measure. Okay. All right. No. All right, all in favor?
Aye.
Any opposed? Great. Modify the 2023 strengthening U.S. public health infrastructure, workforce, and data systems program. Remote.
I do want. We it's certainly beneficial. That is just patient and getting information out. So,
Any discussions or questions on this? All in favor?
Aye.
Any opposed? Next resolution is modifying the 2023 budget for Public Health Department for Administration and Preventive Services Program. Get a motion. Mr. Forsythe, seconded by Mr. Jeanette and Ms. Grant.
So this last resolution, we're just using to catch up our county budget with what we changed.
Any discussion? Would you like?
What kind of expenses do you refer to in the second whereas? Higher than anticipated expenses? Can you give me a few of them?
Sure. So one of the computer softwares,
One of them what?
one of the computer softwares that we had
Okay.
purchased for as a epidemiologist, it was a little over $10,000. This was purchased with a grant. So that is in part.
Thank you.
Any other questions? All in favor?
Aye.
Any opposed? Great. And next we have an update regarding the implementation of a new electronic record.
So in May 25 of this year, we were able to go live with our new system. Since then, our clinic staff have given 815 vaccines to 530 patients. There's been positive feedback from staff on our ends, making it much easier to use. We can pull reports that our old system just we weren't able to do with grant reporting. It also has a text-based messaging system for as reminders as you have appointments as well as voice. So we've been able to use that and save some staff time. That would normally be spent in calling clients. We've also successfully enrolled with the insurance companies that we most frequently bill. And we've been able to bill and accept over $32,000. We're also anticipating an additional $2,244 with what services we've already given. Some things to keep in mind just when we are talking about the billing and that figure. So this billing is what we've completed since we started using Patagonia, so it's not for the full year. There was a period of time in which we had ECW and Patagonia just to allow for the payment posting of bills into our old system. And for COVID-19, that vaccine was free. So it wasn't something we would have billed for up until September 2023. Now, we can certainly charge for that administration fee for individuals who have insurance. And then we also have some clients who do still receive vaccines for free, so that's something that we would bill for.
Any questions or discussion? Mr. Burke?
Did they just do public health? Patagonia?
Yes, it's specific to public health, yes.
Questions? So just to clarify, there is this Patagonia software is managing the billing process.
Yep, so
Okay. Can you do you have visibility of reports into the full circle? Bills and payments as we shift from,
we would order vaccines, they would be shipped to our office, and we'd be able to administer. So we would still keep track of inventory as well as administration, but it wasn't something that we still before for the vaccine. Now, the COVID vaccine is one of
are you able to, when we have, if we have enough, or when we have enough data to follow that picture, are you able to provide a report to the board that just kind of high level reviews the billing expected versus actually received, just to make sure we have a pulse of that? Any other questions? Thank you so much, Beth. Did you have anything else to want to share?
Ellen, if you mind.
By all means. Would you like to remain here? I'll introduce them, and when they're on the floor, you can speak to them. Okay, that works. So next we have two resolutions. I'll just read them off and hand them off to the legislator Haggard. First is urging Governor Hochul and state legislature to allow speech language pathologists, assistants, and aides to practice via license, registration, or certification in the New York State Early Intervention Program to expand capacity for children in need of services in rural areas of New York State. Get a motion, Mr. Light. Mr. Matt, Anisha, Mr. Curran, Legislator Haggard. Start off.
So, thank you. Both of these, this and the next resolution came out of the standing committee at NICER, Children with Special Needs. This one is incredibly important, especially for areas like ours, because we have shortage of all sorts of providers, but particularly in speech pathology. Both occupational therapy and physical therapy have a licensure protocol for their assistants to provide certain services under the supervision of those specialists. That is not the case with speech pathology, and the committee is asking the governor to make that allowed. In other words, so that within the body of this, it says that 2,000 children are waiting for these services in the rural counties. That's a lot of kids, and from my own experience, speech pathology can be something that makes or breaks a child as they're moving through their education. It's critically important. So I brought this back to us, and I asked that everyone support it.
Carly, you want to start off?
So,
Could you turn your mic?
all right. From the Department of Public Health, we do want to send our support for this. We absolutely see this as a need for the children in our county. And as is noted in the resolution,
Mr. Ray.
Thank you, Ms. Chair, and thank you, Ms. Haggard, for bringing this forward. I know this is a important need across the county, and the shortage is severe and real. I think it's important that if we want to get this to happen, and I think it's important that we do, we need to get additional support for it. I think, you know, obviously getting our own state legislators in support is good, but often we're preaching to the choir on some of these things, and they're not the problem. And we need to expand beyond just our own group of people who agree with us. Although I don't know what their position is on this, and I think this will help them become aware. But I think we should also list our school districts and school boards to get involved in this issue, because these children who need these services, if they have these speech problems by the time they get into school, it becomes a really severe handicapping condition to their ability to interact with their teachers and classmates and to press. And, you know, it's just as, you know, important. And I think, you know, we need to think about who else are advocates for children in St. Lawrence County who can reach out to bring to bear on some of these issues. There are lots of groups in the county that are involved with children, and the more of them that we can get reaching out to not just our legislators, but to the governor, to the chairs of the committees that oversee this, to the people on the legislative committees in Albany who are the gatekeepers who make the decisions on whether or not this legislation gets passed. That's what's going to make it or break it. And, you know, we tend to have we tend to ask our legislators who agree with us to go agree with us. And then we feel better. We're like, oh, we accomplished something. Well, we haven't. You know, in my previous life, I saw firsthand, there are people who are from elsewhere who have no interest in allowing more people to do what they do. And they spend a lot in Albany to make sure that they have a monopoly on providing services. And if we want to expand this, we need to educate more people than just the people who agree with us. Thank you, Mr. Chair.
Ms. Curran.
Thank you. First of all, I would like to be added as a co-sponsor. If Mrs. Haggard would allow, Legislator Haggard would allow. I think the last time we talked about this, Carly, there was like someplace between an 18-month to 2-year waiting list from the time we realized that a child needs speech therapy and evaluation till the time they get it in this county. I know that there's not a lot of speech pathology people. I think that allowing the aides and assistants to help in the process of, you know, cursory review of what's going on, and then maybe it would even help us sort of triage who needs to be seen next, or maybe get a televisit in someplace, something that would hasten the evaluation by the speech pathologist and get some exercises going, something. Because I agree with Mr. Reagan wholeheartedly, there's a window, you know, that children can develop speech and come up with normal speech patterns. And when they fall behind their peers, it's what makes bullies pick on them, and people pick them out and start to, you know, make them not want to be part of the milieu, so to speak. So if we can do anything to help get faster intervention, send this to whoever, I'd be happy to help. Anything I could do, but I think this is very important. I think Mrs. Haggard, Legislator Haggard, for bringing this.
Mr. Burke.
It's a really good resolution in that certain order. The underlying theme here is that we don't have enough speech language pathologists, and we don't have enough social workers. That's not the resolution. Governor hopefully to have Potsdam State, SUNY Potsdam, start training people locally so that we can fill these needed gaps. I mean, we ask for everything else. Let's ask for and I think this is important. But in reality, even for an assistant to provide an intervention, I'm assuming it would have to be, there would have to be a screening by a licensed speech language pathologist and then a plan of care instituted. So again, I think we should tackle the underlying problem as well as look for an interim solution.
Right.
I think John's absolutely correct on that, but I don't think the solution is to go to the governor. I think the solution is to go to the colleges and ask them to work with us to develop these programs, because that's how it works. The colleges have to want to provide the major, and they have to see the need. And I think there's definitely a need, and I think there's definitely a shortage. But you know, we've got to convince our local colleges to offer this program and slots and majors in order to get it addressed, because you know, we can send letters to the governor, she's gonna be like, well, I don't know, I don't even know what colleges there are there. We've got to get the presidents of the colleges and their faculty people to work this into their plans. And, you know, that's got to be our approach on these things, is, you know, figuring out what we need as a county and what resources we have available in this county, and harness our educational institutions to provide these critical services, you know, and educate our youth to come back and have, you know, good paying jobs. I've had the experience of working with a lot of young people over the past 30 years, and ran a one-on-one reading program at the Boys and Girls Club in Ogdensburg with a lot of the kids. And several of the kids that were in that, high school kids that were in that program, learned that they really liked it and went on to become speech pathologists and got, you know, their graduate, you know, program. So a lot of it, you know, it can happen. And I think that's the best approach.
Ms. Haggard.
Thank you very much, Mr. Chair, and of course, I agree with both legislators for and to add to it, as we all know, we've read in the press that there's a great reckoning going on right now in terms of teachers that our universities in this area offer because of money. This would be one master's program that would probably be in high demand. We have to look at the nuts and bolts of how these universities operate. So as they're eliminating majors, I don't willing to add majors, but I would even ask our chair. We've talked a lot, and I don't know how we've gone about it, but how we need to talk to the colleges and get them to provide this service or these majors or this major. And if there were any interest, our chairs would have of getting a group of legislators together to facilitate that, either through public health, if that's the right, or some other way. And certainly there are people among us, I believe Mr. Reagan knows the people at BOCES. There are a lot of connections here to the universities. I'm not blaming that at all, but those are the things that they're looking at. So the time is right. Thank you.
Mr. Jeanette.
Yeah,
do have a question. So I think this is great, adding more programs and everything, but more I look at it, so I'll play your game, let's keep going forward then. So we get this influx, we have new majors, graduate, where's everybody gonna live? The infrastructure here doesn't support that kind of people, right? Great, the job market is now we're gonna bring more people, oversaturated market. Now that I have this, but now I have these displaced workers that we brought up here to fill these roles, and now we're gonna, then what? If they can't get these positions, what happens? Or again, where are you gonna live? Like, but.
And I'll take a stab. I think that's called an economy. And I think it grows and we'll have good jobs and well-paying jobs. And when we serve valid, persistent needs in our community, you know, I can speak from experience, you know, you can get a construction loan and work yourself to the bone and, you know, fix up an old house and I think that's kind of a testament to the North Country spirit. And so I think if more people, if there's need and there are university degrees that train people to fill that need, I think we'd see our economy and our community grow in a healthy way, for sure.
You said by taking out a construction loan, so you can put myself more in debt before I get jobs, get the house to get, that seems a little. You know, just.
Works for me.
Yeah, all right, just quite, you know, like, no one wants to get that sweet loan right out of the school after you already. That's just.
Noted. Mr. Reagan.
Third bite at the apple. But the reality is that St. Lawrence County has some of the lowest housing costs in New York State. And, you know, if a young family wants to have home ownership, there is no better place to start out a career than in St. Lawrence County. And as Ben says, you know, you may not be able to buy a brand new house, a McMansion, you know, in a subdevelopment, you know, but we have some beautiful homes in St. Lawrence County that you know, are ready and are available. And you know, I don't think we should underestimate the great opportunities that are available in this county.
Mr. Jeanette.
I think we're underestimating inflation. So that definitely puts home ownership a little further down the road than, right, like, I mean, look at everything going on, look at where I'm trying not to lead it, but I mean, I'm trying to be supportive and realistic, like, yep, let's do it, but let's not just, hey, here we go, and yeah, that's it. It seems like someone.
I think your mic is flipped, inverted there.
I'm sorry.
No, that's great. I had a thought about this resolution. I support it and I think it's appropriate and necessary. The one thing is missing though, and just referencing to Mr. Reagan's first comments, we want this to have teeth and be actually effective, not just be a feather in our cap we've commented on. The thing it's missing is, from my reading, is a sort of medical professional expert opinion. We're a legislative body. This is a medical licensure question. On its face, it looks reasonable, and I think it makes a lot of sense. We may benefit by potentially maybe waiting a beat, maybe it's just one meeting, but to include, to find and include some expert opinion to back that up in a way that isn't just a legislative body.
So I would say this, it would come from the Department of Education, where they would decide how the scope of practice would have to be changed. You know, they probably aren't going to give assessment to the people that are assistants, but they may give collection of certain information and the performance of certain like testing evaluations it's kind of like when nurse practitioners first came on, we didn't have full practice. We had assessment, diagnosis, and whatever, and certain things were still relegated to the MD. So I think all of that would come out of, we can ask for it, but then ultimately the Department of Education and the people who assign who does what would be who would relegate that. But I don't think it's an unreasonable thing to send to them to ask for additional abilities to evaluate versus diagnose. I don't think it says, it doesn't say let them diagnose. It's just about, assisting in the evaluation early.
Desired.
And just to reiterate that occupational therapists and physical therapists both use same.
Here and, maybe we could ask public health. Or, yeah. Well, and I'll say public health.
I don't want to be an obstacle. I think we'd be best off having this be as strong as possible. I'll make a motion to table this just for 1 week, to allow us to gather additional, support from medical bodies or Board of Health and have that articulated. Ms. Hager.
Did you want that to come up with finance or services? Or the cinnamon?
Carly, you can be able to get those in the week? I'm not sure if New York State's gonna move super quickly, so maybe we do push it to the next services committee meeting to give ourselves some time to bolster it properly.
I'll second.
No discussion on a motion to table. All in favor of tabling to the next services committee meeting? Any opposed? Noted. Anyone else opposed? Resolution table. Thank you so much. Our next resolution is urging Governor Hochul and state legislature to shift the administrative responsibility for preschool special education transportation services to local school districts. I get a motion. Jeanette, seconded by Ms. Curran. Agri, would you like to take this one as well?
I will, but I'm going to immediately, after I make one comment, chime in, but this is an important resolution that also came up at our committee, and I said, the 8th whereas, I think I counted correctly, probably the most important, even though this is a money saving resolution, the fact that schools have so many more resources in transporting a very, very special and specific population, I think is one of the biggest things about this. Now there's money saving involved, and I'm going to let you speak to the fact that your department has done a fabulous job in St. Lawrence County getting school districts on board with this. We still have 3 to go, so if you don't mind.
So, the public health department also in support of this resolution. We do feel it would be a value as a children in the state that transportation is housed within the school district. Right now, we're really only responsible for paying the bills. would make districts more responsible for their already things. Resources already in place. Was it something that we had already had in place? Prior the item for the child, but it's something that the schools already have in place for the school district, so it makes sense that they would be housed.
Just say you're bringing this forward. I think we've seen this one before. I'm sure we've seen. Down in NICEAC, they did say that the Indian land actually become, well, keep it on the table, keep people discussing it, whatever. And at first, I think, well, if I pay for it in my county tax or I pay for it in my school tax, what's the, you know, really, that's my one thought. So the third whereas from the bottom pretty much said that, and they realized that, but the one below it, possibly, it would fall under a shared services agreement. So that's optimism, which I would hope, but why couldn't it fall under a shared service agreement now? Why does it have to be passed on to the school to do it? Why can't we just do it now? And third, I was hoping maybe with the way that the state aid reimbursement school districts area, maybe that could come into play and offset the cost. But yeah, it's a huge cost to the taxpayers one way or the other. But I'd like us to be able to at least get an answer if it's possible to do a shared services now. Maybe whatever. Thank you, though.
Or one of the school districts. Some pushback just for being contracted, so so we are negotiating with them, hopefully to get them signed up. The other two, I don't have.
With 30%. And I see 60 passenger buses going up and down the road picking up pre-K kids with 3 or 4 kids on a bus. Compared to Head Start with smaller 20 passenger buses. And they're moving, 8, 10, 15.
The pyramid is individual child specific, so depending on what services they might need, they do have to sometimes get further to a district that can support them with the services that they have. So that's why you might see the buses only picking up 1 or 2 or 3 children. As far as your question.
Yes. At this point, like I said, I see 60 passenger buses with 2 or 3 pre-K kids on it.
Mrs. Haggard.
Thank you. On the first whereas and the second page. Districts utilize. The cost is 78% in 2022. And those people
Any other discussion on this resolution? Hearing none, all in favor? Any opposed? Thank you, Carol. Drop that down. We'll move on to county administrator vacancy review committee.
So there are 3 departments of the evening is weights and measures. That's Phil. Yeah.
New legislators, and I've overseen me up here, my name's Adam, I'm your Director of Weights and Measures. So this is a conversion, taking us from a transitional role to a full-time provisional role. You have allowed me to hire, prior to my former inspector's retirement, to hire his replacement. He was hired in a transitional role. Now, following Scott's retirement, we'll be looking to convert that transitional role into a full-time position. I would say, minimum a year, hopefully by 18 months, we're confident in all facets of the role and able to function.
The board allowing Adam to hire earlier, I think was very helpful.
Absolutely. Yes, would agree wholeheartedly.
Thank you.
Thank you.
Next up, we have a return clerk from social services with 2 positions this evening to present for consideration. Thank you.
Critical position that I have is a keyboard specialist in children's services. This individual resigned with some medical and some family issues and just figured that this is better. Time leaving us short this critical position. So this position is going to prevent foster care side. This individual is responsible for doing a lot of the paperwork and processing the documents we have to go through foster care adoption processes, tracking kids, making sure we get kids out of care on a timely manner. Also helps us do the paperwork that keeps us in compliance with our state audits. It's really important that we keep up on top of that paperwork. They work a lot with Mr. Button's office and his attorneys. So I'm asking your permission to fill this, or your permission to fill this position.
Questions for Commissioner?
And the second one I have is my grade A supervisor, children's services and the foster care prevent side. Our long-term grade A supervisor, who's been with us for what, 34 years, I believe, had recently retired and moved on. Some long-term service. So this position is really vital. They supervise all of the grade B supervisors. They participate in a number of different meetings and task forces in different groups across the state. They represent us in those issues. They work with our permanency hearings, violations, compliance hearings, review all the paperwork that goes over to court for foster care placements, for the adoptions, make sure that the grade B supervisors are trained properly. This position is absolutely vital for us on that side. Right now, I have appointed a 90-day interim to that post. But it's really important, I think, to get this position filled so that we can continue to make some changes over there. Children's services and improve the quality of services that we're providing. So I would ask your indulgence. for this decision.
Questions?
Just, not related to this. Turnover, are we still struggling with staff turnover? How many items are?
Talking to my counterparts across the state, we're all experiencing it. Turnover is an all-time high. We're finding that it's very difficult to compete with, in this county, with organizations like Life Plan, Psych Center, Citizens Advocates, who are offering either more competitive salaries or opportunities for remote work. We've lost a number of people to remote work. So yeah, we are struggling a bit with turnover. I think it's slowed down a little bit. I'm making getting those interviews done, we have positions filled by units. But it's an issue.
Join us to present on same title, but two different positions. Okay?
Okay. We're asking to fill 2 case management positions, manager positions. These would be new to our department. This is in response to receiving a $489,000 grant from Oasis for outreach and engagement for the SUV population. So I mean, they would be hopefully helping the homes population by buying and housing, increasing hospitalization services, hopefully increase the attendance for appointments or treatment services. And unlike the peers that we currently have that have a similar role, the case managers would be able to work more closely with the patient. That's not a role that support peer support services boards. So we're asking to fill these 2 positions. We do have a case manager now. Last year, she brought in $1,000. So that position did pay for itself. This is a 2-year grant that spans over 3 years. We will be able to look for year 2024 what the level of revenue is. Report out to you to see if you want to keep this position once the grant ends.
That's correct.
Are we able to bill even though they're funding the?
We are, yes.
Yeah.
So this $39,000 of cost, revenue, very conservative. But I mean, there is startup, training, exposure. So.
Any other questions? Thank you, Jay.
Thank you.
Just a couple of items to give you an update. We will have PCC, presentation concept corporation, I believe. They will be coming in tomorrow morning at 1 o'clock. Will be found in this room to start giving us a better idea. We have a very aged quote that went along a couple of years ago when we looked at this. I think following that initial online presence and a recognition that we're going to stay online, certainly hearing all of you, we're going to get that quote refreshed and talk with you more about that. I do want to let you know how much I appreciate the updates approval tonight at committee for social services. I think the overall strategy has been a couple of years in the making, but to approve the updates while also recognizing that our satellite offices are successful in both Ogdensburg and growing in Messina. I've talked to the commissioner and we're looking at potentially bringing you another proposal for an additional satellite office. So we'll be talking with you more about that. We have created a successful presence in the Clifton Pines School District, also at the hospital in that area, for the more remote populations to have connection without having to come all the way to Canton. I mentioned to you last month that Commissioner and I attended the BOCES meeting and talked with the superintendents. There are already districts interested in furthering that relationship with social services. So again, that's a further expansion into that change in approach. Instead of everyone having to come to Canton, we're taking the services to people where they are. And so I also think it's presented a terrific opportunity for the building to see some improvement in that work environment to get better. Did want to mention to you, so that you know what's happening this Wednesday, the EAP sponsored wellness fair is scheduled to take place. This year is the first time they have made a determination to try an off-site location. They have over 24 vendors thus far, and it's going to be at I believe it's the Leakhead Field House that we became familiar with during COVID for vaccinations. So employees are familiar with that location. There'll be shuttle service available throughout the day from 9 to 2. Generally, this wellness fair takes place on campus, either here at the courthouse. We've moved in the last few years over to the Human Services Center, and I would grant employees 2 hours of leave time to attend and visit with the vendors there. There's also, I think EAP sponsors some prizes and different kinds of interactions to make sure folks interact with our vendors and find out about services that are available. And so this year, considering the offsite location, we'll be providing services, shuttle service over and back from here at Court Street, and then also from Human Services, and if needed, from the Highway Department to get folks over there and to shuttle them back to their work location. We want to make sure you are aware. We're looking forward to hopefully seeing high attendance. Public Health is offering pre-scheduled appointments for flu shots at our wellness fair, as well as taking appointments in their clinics on Tuesdays and Thursdays. Questions? Okay, we have a number of items, I think, out of the conversations tonight that we'll follow up on and provide you updates as we have them. And next week, I'll be presenting you the 2024 tentative budget.
Thank you. Next week, committee reports. Ms. Graham, you have a report on One Health.
I do. We met October 17. The changes in the lead monitoring are substantial. We changed it, I think, 3 years ago. They cut in half how high the lead could be before you had to be monitored. We doubled the number of people. They follow about 80 people a month. They're going to cut in the next 18 months the level that you could have of lead again in about half, which means we're going to increase the number of people that we're monitoring. They're doing something called lead detailing right now. They're going around to practices, trying to figure out how they make sure they get everybody's 1-year-old and 2-year-old lead level. And it's not as easy as you think. You see the doctor, they order the test, but then you got to get the parents to go from the doctor's office over to get the labs drawn. So then the next thing is, where is Paxlovid, which is the outpatient oral antiviral that they give people for COVID. They have a list, the pharmacies all have a list of who has it. There's a little locator that you can go to, and I'm going to send Ruth the actual site so that you have it with you. But they do have a way to figure out where it is. Some ERs carry it in their Pyxis in the ER. If you go there, you have COVID, they hand you the full dose so that you're taking care. The sanitarian update, I'll give to Ruth, it's very small numbers, complaints that are lodged to the public health department, and they take care of it very quickly. The update with Walk with a Doc is that they're doing more of those. They're going to have a list of where the next ones are, and like in anybody who remembers the late 70s participation from Canada, they had sort of a similar thing where they would have doctors' places you go out and do sports or walking with them, it's kind of neat. And then we got an update on the community health improvement plan, which I will send to you. Because there's a lot of information and I cannot do it justice here to, unless you want to stay till about 8 o'clock, 9:30 something. So, our next meeting is gonna be in December because we are not meeting the Tuesday before. Anybody have any questions? Harry, you have a question?
On the lead abatement program, is that still in effect?
They still have lead abatement programs. It's separate from the monitoring the Department of Health does. I think that comes out of planning with Jason Botenauer. And what they do at the Department of Health is literally every child at age 1 gets a lead test. Every child at age 2 gets a lead test. If either one are positive, they buy a spot with the Department of Health to have their lead regularly monitored. Depending on how high it is, treated. They go in and figure out like maybe where did the lead come from. But the lead abatement program is under planning.
Any questions for Ms. Curran? Thank you. Mr. Burke, DEP Board of Directors?
We met last Wednesday. Three of the programs, excuse me, three of the programs were reviewed. Still struggling with start role. Somewhere in capacity and it's been a struggle. The other probably big thing is the Canton Neighborhood Center. That is struggling big time. And I just wanted to say that neighborhood center provides services for the towns of Canton, Clare, Prairie Mills, DeKalb, DeGrasse, Herman, Tyredes, Rensselaer Falls. So it has a pretty broad scope of towns and services. But it's really struggling. If anybody else in that.
Right. When you say struggling, what is that?
I think it's.
Has there been any thought about seeing if you could co-locate with the Church and Community Worker Program downtown in Canton?
I don't know if there's been any thought, not that I've heard. But I think anything should be, what they talked about is maybe moving it from Canton, one of the smaller areas, be it Morley, Tyredes, moving it to see if it would be a higher utilization. I don't know, but I think it's worth exploring. Maybe some kind of church community.
You've got a very successful program in downtown Canton, and they both have similar missions, and it would seem that working together might be better than working alone.
I would share your.
Any other questions, discussion? Next we have Mrs. Haggard with Community Service Board.
Thank you, Mr. Chair. I was unable to attend the meeting on October 3rd. Next meeting's on the 7th of November. I'll update you at the next first.
Thank you. Mr. Denisha, Office of Liaison Advisory Board.
Sure, we have not
met since my last report, however, Andrea Montgomery did send a letter this afternoon, I believe. And sent it to me, because I was on the advisory board. And what it is an advocacy letter from the Association of Aging in New York to Governor Hochul's office, requesting additional funding for the aging network. I thought it was important enough that I responded to Andrea and asked her if she would send the letter to all of the legislators. I'd like to take this opportunity to thank Mr. Forsyth already for responding to the letter. I had signed the letter as legislator for District 6, and I would I would ask that all the other legislators would also sign the letter in their capacity as legislators for their district.
Comment? Question? Forsyth.
I think I got there about 5 minutes. I just happened to check my email. I saw that. It was easy to do. You go to the page. I did share this. Thank you.
Legislator Terminelli, you hear me through the internet there?
I can hear you. Can you hear me?
We can. Do you have a report for the Youth Advisory Board?
Sure do. The youth committee met this past Sunday. And during that, they just kind of talked about the Chalk the Walk success through this St. Lawrence County Suicide Coalition. And then they also did QPR training with the youth kiddos. Our next Youth Advisory Board quarterly meeting is Tuesday, November 7th at 5:30 in the Human Services Conference Room. At that meeting, we plan to introduce the Youth Committee Chairman, Anant Bansal, to the rest of the Youth Advisory Board because he will attend both of those meetings so that we can have some sharing between the Youth Committee and the full Advisory Board. Also, the Allocations Committee will be getting back together to review applications from our area community programs and nonprofits for our newest funding source from OCFS, which is the Youth Team Sports. This possibly could be a one-time funding source. We're hoping not. So they'll make sure to review all of those programs and allocate as many as they are able to. Our youth committee teen ambassadors just received notice that they're going to be getting a $500 grant from the Youth as Solutions. It's part of the National Youth Leadership Council. There are teen ambassadors that will be leading this project, and they pretty much identify a community need, and then they figure out a way to do a service learning project in and around that. And I'll keep you updated about that along the way because they have until April 2024 to present their project. Then let's see, our New York State Youth Bureau's annual convention is next week in Syracuse. So Alexa Backus will be attending because she is on that board as the Northern representative. And then finally, I know I've talked a lot about the Gizmo mental health project around St. Lawrence County. That program continues. Just last week, 120 students have signed a mental health action plan from Messina's Madison Elementary and Ogdensburg's JFK. So we're excited to see that partnership between the Youth Advisory Board or Youth Bureau and Mary Wills and the People Project across the county.
You, Legislator Terminelli, does anyone have any questions or discussion for a report? Under old and new business, does anyone have any old business bring to the meeting? Okay, hearing none, under new business, I have a resolution honoring the Hubleton Volunteer Fire Department, Lisbon Volunteer Fire Department, and Morristown Volunteer Fire Department for rendering mutual aid to the County of Jefferson and commending all county fire departments and rescue agencies for answering the call for mutual aid. Their motion. Mr. Lightfoot, Mr. Forsyth, Ms. Haggard, Ms. Reagan, Mr. Burke, Ms. Curran, Mr. Denisha, Mr. Forsyth, want to start with that?
Thank you, Mr. Chair. You know, a lot of times we talk about the bad things in St. Lawrence. I'd like to talk about the positive. That's right here. Last Thursday, The county administrator reached out to me, said we had 3 trucks on standby, 7,000, 6,500, and 6,000 gallon tankers ready to go to Watertown. I didn't even realize anything was going on. They had no water. We want to talk about inconvenience for 3 to 4 days with no water. You know, inconvenience should become. It's unbelievable, almost unbearable. Anyway, they followed, they tracked it. Ruth kept me abreast during the day. And I watched it on TV that evening. I watched the dilemma they were in, catastrophic. Luckily, it happened when it did, and not when it's 20 below, and usually these pipes break, but luckily weather was on our side. My first question was, okay, these 3 tankers are going, who's gonna back them up? Still have their 3,000, 3,500 gallon tankers available, plus neighboring county or towns were on call, I'm sure. So I felt good about that. They went down, they did what they were called. Matt Denner called me Friday afternoon, just gave me an update, made me assured that everything was set. We've done all our best intentions, we've done everything to the best of our abilities. Later, I got thinking about it. I said, gee, so I reached out to Ruth and Mr. Button, talked to both of them. I said, yeah, there's got to be something we can do to recognize these people who do this. You know, your neighbor calls, they got an issue, and you go home. That's, you know, that's not Country Valley, right? So that's what we did. So it's self-explanatory. I just want to thank everybody involved. I think it was a huge effort and the most justified cause I could ever think of. So when we call these people, we hope they come and we hope they hear us. They hear us loud and clear. So thank you all.
I'd like to thank all the board members for listening to Ricky today. I think he didn't make one until we scheduled it today quickly. And he really appreciates it. It's been an awful lot. I don't think we can. Thank you very much.
Any other discussion on the resolution? Mr. Forte?
At the end, it is co-sponsored.
What's that?
At the end, it's like a sponsor.
We could probably, we'll look into it. Yes. Guarantee every single, there's not a single volunteer firefighter or emergency service person in the county who does it for the glory, for the accolades, but every chance we have, glad we can take to say thank you. And sorry, no, only 2 bites at the apple for you, sir. No, Mr. Forte.
I just want to thank the county attorney. They helped it. Appreciate you. Validated this one.
All in favor of the resolution?
Aye.
Any opposed? Sure. Is there any other new business? Hearing none. Oh, Mr. Forte.
Thank you, Mr. Chair. Again. I did receive today an email from New York State Parks and Rec, on behalf of New York State Parks and Rec for preservation. We have been awarded the
Any other old business? What else do I need for executive?
There is for litigation, negotiation, and personnel. Personnel being the medical, financial, credit, or employment history of a particular person or corporation, or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation.
And before we consider a motion to enter executive, is there any objection to these 4 individuals joining us? John Murad, Marguerite Massach, Sis Copeland, and David Warren. Is there a motion to enter executive session? Ms. Curran, seconded by Mr. Perkins. All in favor of entering executive session? All right. Any opposed? Thank you.